So everyone, thank you so much for being here for the Growing as a Community Leadership in Action. I'm Mercedes Piedra, and I am a director at the Office for Health Equity, Diversity, and Inclusion here at UC Davis Health. We have had a full week of principles of community activity, actually here at the health system, over 25 opportunities for attendees to learn more about the principles of community, diversity, equity, and inclusion. Today's guest panels are our leadership. Our principles of community are our guiding principles for the behaviors that each and every one of us as community members, as colleagues, and personally for ourselves to lift up in all that we do. Our guest panelists today are our leadership who are supporting the large workforces across the health system of 13,000 employees. We have a few of the leadership here today. So Dr. Allison Bristier is the Dean of the School of Medicine. She joined us in 2019, and she leads our research, academic, and medical training for the School of Medicine. We have Mike Condren, who is our Chief Operating Officer for ambulatory care, which means he leads the outpatient care for over 70 clinics, over 25 locations, with roughly 1 billion patient visits for physicians. Then we have Steve Cavanaugh, who is the Dean of the School of Nursing. He leads our School of Nursing, which consists of 5 graduate programs and focuses on interdisciplinary graduate groups. The school is the youngest school at the UC Davis Health campus, I believe 10 to 11 years, Stephen. And Dr. Cavanaugh has joined us also in 2019. Then finally, to anchor all of our great information and work that we're doing, we have Toby Marsh. He is the Chief Nursing and Patient Care Services for the UC Davis Medical Center. He oversees roughly 1,800 nurses and nurse practitioners who provide care for over 200,000 patients annually at our 625-bed acute care hospital. Leaders, thank you so much for joining us here today, and welcome. So today we're going to be finishing off our principles of community. And so just to ensure that everyone has the principles of community, we're going to put the link in the chat box so that everyone can call it up on the computers or their smartphones and be able to look at what these principles really comprise. I'm just going to read the prologue and perhaps just some points of the principles of community that our leaderships are going to also talk about today. So the UC Davis is a diverse community comprised of individuals having many perspectives and identities. We come from a multitude of backgrounds and experiences with distinct needs and goals. We recognize that to create an inclusive and intellectually vibrant community, we must understand the value, both our individual differences and our common ground. The University Principles of Community is an aspirational statement that embodies this commitment and reflects the ideas we seek to uphold. So the actual principles, I'm going to take just a minute to read, which states the University of California, Davis is first and foremost an institution of learning, teaching, research, and public service. UC Davis reflects and is committed to serving the needs of a global society comprised all people and multiplicity of ideas. The university expects that every member of our community acknowledges, value, and practice the following principles. And these principles are very specific. We affirm the dignity inherent in all of us, and we strive to maintain a climate of equity and justice demonstrated by respect for one another. We acknowledge that our society carries within it historical and deep-rooted injustices and biases. Therefore, we endeavor to foster mutual understanding and respect among the many parts of this whole. We have the link once again in the chat. Once again, these are the behaviors that we expect of every member at our system. So it is an obligation for us, and at times I take them personally, and I feel they're the principles of responsibility. So to start, we're going to go ahead and start the conversation for everybody to hear how we embody these principles, and also for you to get to know this wonderful panel of leaders. So we're going to start with Dr. Allison Brashear. Allison, what do the principles of community mean to you?
So as a physician, an educator, researcher, the principles of community really are core to everything that we do in the School of Medicine. They mean professionalism, integrity, respect, inclusion, and really creating opportunities for everyone to achieve anything that they want to do. You know, I really want people to achieve excellence in the roles that they have and aspire to greater opportunities. So that means we want students to learn all that they need to learn to achieve the roles they want. The same for faculty and staff. And to me, that's one of the wonderful things about academic medicine and having an integrated health system. I also think it's really important to foster diversity and inclusion. The more diverse our thought processes are, the more innovative we are, and the stronger it makes us as a community. And it's more that we're able to reflect on the things that we can do to serve others. And that's really part of the core of the School of Medicine. And we strive to teach a diverse group of student bodies, have a diverse faculty, and we feel like that actually meets our mission of improving health for the current and the future citizens of California.
Beautiful, Allison, thank you. Mike.
Thanks, Allison. And Mercedes, thank you for reading them at the top of the segment, because I think that was really helpful. I mean, to me, they're a covenant. They're a contract that we agree to when we join UC Davis. They're included in our position descriptions, and we commit to the set of principles that you read, you know, that set a tone of acceptance and fairness and equal treatment and respect for each other. And it's really an agreement that we enter into and brings us all together on common ground as employees. And when we or our colleagues stray from these principles, they're there to remind us, you know, of that agreement and to reference in times of need and to hold ourselves and each other accountable to. And when we encounter words and actions that are inconsistent with the principles of community, we can clearly say, that's not us, that's not who we are or who we aspire to be. So they're really, really an important fabric of our institution. And importantly, I think there's a really big source of pride for us. You know, I think that we work for an organization that benefits diversity of thought, experience, culture, appearance, insight, perspective. And it's good not to take that for granted, because not all workplaces share those same values and principles. So it feels good to come to work every day for an organization that does. And I certainly don't take that for granted. So it's part of what makes UC Davis a really great place to work.
Beautiful. Thank you, Michael. So, Stephen.
Yes, thank you. And two very, very powerful beginning statements, all of which I absolutely agree with. And coming here on the same day as Allison, and some of you may know that, one of the most amazing things about this organization, one of the things that really attracted me was this sense of community. This is not an add-on. This is not a veneer. This is something that is deeply rooted in everything we do. And that must happen in our organization, through our teaching, all aspects of what and I'm actually not just personally believe it, but also see it being done every day. And I think the comments about getting everybody to be as successful as they can is hugely important. And also opportunities for leadership, because part of what community is about leadership. And I'd also add, because as a personal experience, I would say that principal community are still a journey. And I say that because nursing, like many other fields, are so much influenced by the society and culture in which we fit. And we have to work very, very hard to ensure that what we do really is meeting not just our own internal aspirations, and they're very high aspirations indeed, but also those of the people we serve, and picking up on what Mike had just said. And I would just like to give you one example of how principles of community from another institution, and Toby, don't get too excited about this, I'm not advocating this, by the way, is why you have to be brave. And I just want to say that principles of community to me is about grasping the nettle, it's about being courageous and being brave. And so here's an example. Some years ago in the United Kingdom, the punk era, okay? So you must imagine that I walked into nursing where everyone was clean cut and wonderfully prepared. And then the punk issue came along. And so we started seeing people, patients, and nurses coming along with spiky hair, with all sorts of adornment and colored hair in particular. And I remember my own view, personal view, that we must meet the needs of our patients. I had the challenge as being a director of the school, one of my first leadership positions, of the red-haired nurse who didn't want to change their hair color. And going through the realization that this really was matching what was going on in our culture right now, and that to create artificialness was not helpful. The redeeming factor was when I was told that the red-haired nurse was looking after the green-haired patient. And so we begin to align some of our beliefs, taking courageous steps in changing policy. And they're the sort of things we do. And I think UC Davis does better than anywhere else I have seen. And to me, it's that courageous step, that calling things out and being very clear, as we're doing today, about openly talking about what community means to us. So in addition to all the other great things being said, it's a personal journey, really trying to find our way through a changing society.
Thank you, Stephen. And Toby.
Yeah, thank you so much, Mercedes, for having us here today. And then I think the principles community for me really is an anchor, right? I think I really, as a leader in healthcare, I really look at structures and processes as a way for us to be successful in an organization here at UC Davis. And when I look at the principles community, I think it's an anchor. I think it's a set of mutual agreements about how we show up, how do we control the energy in the room, what are my responsibilities? And I point to the direction of anchor because when I think about the insurrection that just occurred or the protest because of the police killings and so forth, it really elevates the reason why Principles of Community, this document, is so important. And it's also important for us to realize that this document was also founded out of strife and discourse on our own campus in the early 90s. And so while it's aspirational and ideal and it's directional, I think it has so much weight and value by so many of us here at UC Davis because it came to us because of our own strife and our own struggles about how do we come together from different backgrounds and diversity, et cetera. And so I think that's one of the things that really resonates in what it means to me. I think it lets others allow them to, if they're joining the organization or they're looking at why should I come to UC Davis, I think it allows them also for a sense of, that you belong here. When you look at the different type of people that is described here as part of our community, that also describes to me the richness of so many people's backstories and the richness that they bring to the organization and coming forward, and that there's value and people have value in recognizing that. And also I think it gives voice and dignity to that acknowledgement as well as the two different people's backgrounds. Because some people wonder if they're relevant or if they do belong. And I think calling them out, listing people out, specifically their backgrounds, helps people feel like they can have a voice, that they have power, that they're enabled. I really resonate with Allison. When I became a nurse, one thing that called out to me was our ANA, American Nursing Association Code of Ethics, and also our social contract. And this Principles of Community really aligned with that. And I think it's one of the reasons also many of our nurses reflect on it, and it's intertwined with a lot of the work that we do here at UC Davis, which I'll be able to touch base on a little bit more with some of our programs that I think help strengthen, align, and lift up our principles of community.
Beautiful, thank you all. And so, right, the principles, everyone, really serve as a broad but inclusive statement of expected behavior for each and every one of us. So it's reinforced by the university setting for an open and fair place of ideas and identities. So thank you all. So Toby, as you raised, 2020 was quite the year with the pandemic, with the social unrest, with the economic downturn. just so much had been going on. And as I listed earlier, Stephen and Allison started with us here at UC Davis in 2019. Mike, you have this post since 2019. You've been with us for almost 20 years, but have stepped up to this plate in this very large leadership role. And so with that, 2020 comes, and man, more than ever, did we need to lean on these principles of community. So within this time, and really before all of the social unrest, it really grounded us to really include everyone and have that dignity and respect for all. So my next question is, as we've come together, how do we operationalize the principles of community? We read them, right? But then how do we operationalize them to work for our teams, to everything that we do, to the service of our students, our healthcare providers, and the patients that we serve? So Allison, I'm gonna let you start.
Well, Mercedes, thank you. And it's such an important question. You know, we can talk about principles of community, but operationally, we need to really put them in place. And a secret is when I came here, someone asked before I came what my favorite word was. And that actually is my favorite word, is operationalize, because I love to take vision and make it reality. And I think the core of all that we do are the principles of community. So that means we want to really live and breathe those values every day. We have so much to learn from each other in the School of Medicine and across UC Davis Health. And one of the ways we do that is by making sure that we're setting up opportunities for everyone. So I'm very pleased to talk about the Dean's Diversity Council that we're set up, and we have partners in each of the departments that are actually going through the IDARE tool set up by Dr. Hendry Tan. That's a tool that is a framework for the work that we're going to do in the Diversity Council. We've also appointed two new deans, Jorge Garcia and Dr. Ruth Shim, as two new associate deans. But I really want to make sure that we're being very inclusive and we're bringing the outside in so that we can all learn from each other. And we're bringing, we brought Valerie Montgomery Rice in October. And now we're going to bring in Dr. McDade, who is the Chief Diversity and Equity and Inclusion Officer for the ACGME. So it's really important that we all live as a community and learn from each other, respect each other, and realize that the more diverse we are, the more we can really meet all the aspirations that we have as an organization for our patients, for our faculty, our students, and our community. I've been working with White Coats for Black Lives and the SNMA organizations and other parts of the students and residents, and they brought wonderful ideas to the forefront. And actually, they did a racial justice report card, and we developed in the dean's office with the students an action plan, and just recently posted this. You know, we are going through an LCME accreditation. They'll be here in February of 2022. It's supposed to be February 22nd in 2022. And we are doing our self-study now. And one of the things that's really important is a learning environment that we have for our students, but really the environment that we have for everyone. And the principles of community are really foundational to that. Professionalism, respect, inclusion, and really a respect for the diverse group. So I'm so proud of all the work, the School of Medicine, of our new leaders that have joined us, of our students for taking initiative on their own. And I'm really, really pleased to partner with my colleagues on the screen, Toby and Mike, and always with Steve. He and I are just constant partners. He and I did a town hall just yesterday. So it's really a wonderful organization, and I'm really so pleased that it actually puts into reality all the principles really on a day-to-day basis.
Mm-hmm. And Allison, you made reference to the IDARE initiative, and I just want to tease that out. We use so many acronyms here, but the IDARE stands for Inclusion, Diversity, Anti-Racism and Equity Initiative. And Allison, how many departments do you have these DEI, I Dare?
So each department, we have 25 departments in the School of Medicine. Each department has a representative. They are represented on the I Dare, so they'll take special training in diversity and inclusion, and then they will also work with Hetty and Dr. Henry Ton, and they will actually develop data for their departments, and then they will actually be also the representatives on the Dean's Diversity Council. So that's one of the ways that we've actually linked both the tool development to ongoing organizational structures that are really challenged to push us forward as we aspire to be a more diverse and inclusive School of Medicine and community.
Thank you for your leadership there, Allison. I'm going to move over to Mike.
Yeah, thanks, Allison. You have so much going on that I'm aware of all the pieces, but it was nice to hear it all together at one time. So thank you. I enjoyed catching up on that. I oversee outpatient operations, so my comments will be focused more on the clinics, but I think they're transferable across the health system. I'm so proud when I visit as a employee or as a patient to visit our clinics to see the diversity of our workforce really reflecting the diversity of our community. And that doesn't happen by accident. It's a lot of hard work, and we're not where we want to be, but we're improving every day in this regard. But I'm confident that's not lost on our patients. So human resources is really key to operationalizing this, whether it's from recruiting, hiring, mentoring, developing, advancing, retaining a diverse workforce. A lot of this starts with our human resources partners, and I'll talk a little bit about that a little later on. I do want to talk about the pandemic because it's been so hard in so many ways, with most poignantly loss of life and loss of jobs and severe illness and adverse effects of our health and well-being that will probably last for some time. But there's been some really important things that we should pause to recognize and celebrate as they relate to the principles of community here at UC Davis Health. I mean, this organization and the individuals who work here are just unbelievable in times of crisis. They really rise to the occasion. I don't know if it's our background as a trauma emergency hospital or our overall culture, but the way that we come together in periods of challenge is really amazing, whether it's within our work units or across the multiple departments. It's just incredible to see. I've had the privilege of being part of helping to orchestrate our response to keep our employees and patients safe, first and foremost, and then to set up our testing protocols and procedures for COVID testing, and now more recently with the vaccination clinics. It's really amazing to see the work that's gone on across hundreds of people, thousands of people probably, and the multiple divisions between nursing and ambulatory and pharmacy and HIM and finance and public affairs and marketing and human resources and IT, the list goes on and on. And I think the general theme that I see is kindness. I really see people being incredibly kind to one another, to our patients when they come in. I can't tell you how many compliments I've received around the Mind and Roseville clinics from everyone working there, from the people who are screening at the entrances to take temperatures and to check people in and ask the screening questions, to registration, to check in, to giving the vaccinations in our clinical teams, pharmacy teams, the observation teams. It's just been amazing. The scheduling teams on the phone, it's really been amazing to see. And again, kindness really comes through, and that's the word that's used most often in the compliments. Not efficiency, although all those things are true, but it's the kindness with which they all approach their day. And I don't think that happens by accident. That's not a switch that you can flip on and off. I think that's part of the fabric of who we are as an institution and a reflection of our employees. Now Dr. Henry Ton, I do want to mention Dr. Ton because he's been such an incredible advisor and guider in this space around equity and health equity for vaccinations. And there's many more with him amongst our faculty, staff, residents, trainees, both in nursing and in medicine, who are interested in this really important issue of being equitable and making sure that our community all receive the vaccine, those that are most challenged in getting it or most fearful. And so We are starting to launch later this month clinics in Oak Park, at La Familia, and other locations across Sacramento. That spirit of partnership is now extended across the Sacramento County, Dignity, Kaiser, Sutter, and UC Davis Health in this regard. So really nice to see our community at large come forward in this way. And the volunteerism of our clinicians has just been incredible to staff these outreach clinics. So like I said, I think this is a direct reflection of the principles of community.
And Mike, all that you're offering really supports Dr. Tan's new initiative of being an anchor institution. UC Davis Health is working toward anchor institution for all of the communities we serve. Thank you. Stephen, we're going to move to you.
Good. Mike, very, very powerful words indeed. Pride. I think that's something just oozes this institution. I absolutely agree with you, and it's palpable everywhere you go. And I like the word kindness too, because I couldn't put my finger on when I first arrived what it is that set us apart amongst all the other institutions I'd worked with. And I think kindness probably is the word that really sets us apart. And I'll just pick up just a couple of examples, particularly with the vaccine clinics. I know it's been a tremendous effort to set these up. These are the community vaccine clinics. And I was fortunate a couple of weeks ago to go to the one at the Del Rio School to be able to work with both PA students, nursing students, medical students, graduates of all those programs coming together with a single mindset to work with communities and to really tell folks about the wonderful things that are going on. So that really is a very powerful moment, I think, for everybody to participate in those activities. And I know there's an awful lot been going on to get us to that point. As you probably sense, one of my themes here is about action, because it's very, very important that we ensure that the good things we're doing are communicated, that are really into everything that we do. And so there's a number of things that I think the school has been doing in collaboration with both medicine and others to really try and advance those principles. And certainly one of the first things I did in speaking to faculty and staff was to really look at our mission and vision and to talk about reaffirmation. And really what I meant by that was really aligning everything we did with our principles of community. And this was an exercise that actually produced things far beyond what I imagined, not just the depth of commitment to this institution and its principles, but also a sense that we can advance those boundaries further. And just to pick up a few things that came out from our discussions that really are part of our action for the future is really look at community connections, that part of what we do internally must also begin to impact even more in the communities in which we work. And that's certainly been a central theme of what we've been trying to do. Also leadership. These activities need leadership. And from my perspective, and those of you, and perhaps Toby will recognize some of these things, I am a great proponent for leadership and women. I've been very fortunate, in fact, even today, to have a shared leadership with both a man and a woman, the provost and David. Most of my life, I've been fortunate to be working with women leaders. I've always been amazed, and I share a passion with Alison to advance women into leadership roles. And that's a very important part of what we do. What we do now has to be perpetuated. We also have to work for collaboration in so many things. And I'll talk just a few moments about where collaboration is so important to what we do. And some of those things are tangible things, such as Jan Maria Garcia's now famous, if anyone has been on it, interprofessional bus trip. The opportunity to see in our own neighborhood, not just poverty, not just the opportunities for moving what we believe to be important along. And I was shocked in some things, pleasantly in many, but realizing there are still some communities who are in great need of the sort of services that UC Davis can offer. And still some of the prejudice and hurt that are felt in communities, particularly, for example, in the transgender community, where I am still trying to think of ways in which the school can help some of these very small clinics, often run out of no-name doors to avoid being identified and harassed in some of the cities and towns that we have visited. Tremendously important things. We also, building on that, of course, have to model much of what we do. And so in collaboration with medicine and others, we do our poverty simulation, a real living example of how our principles of community come together internally and externally. And I think I'm very proud of that. And that's work which we will continue going forward. But also in terms of action, as we've picked up upon the collaboration with Henry Ton has been essential. We as a school created a Associate Dean for Diversity, Equity, Inclusion in Dr. Piri Ackerman-Barger. And that's very, very important because it would be very easy to imagine, well, we create these positions to sort of give oversight to things. Quite different in the school, and I know in the School of Medicine too, we are looking at every single operation with a new lens, a new perspective, almost a kaleidoscopic thing. We're looking at things closely and then pulling back just to see how things are working. And these are very, very essential to things that we're doing. We've also integrated training, the SEED training, the educational excellence training, and certainly we've set ourselves some very ambitious internal tasks because what we do to build this community happens in every interaction. I love Mike's example of you can't switch this on and off. The interactions we do have to be maintained throughout the classroom, through our clinicals. And as we're delighted to partner with Toby on so many of our clinical aspirations. These are things we really believe in and move forward on. We also have some other training, which I won't steal your thunder on, Toby, with our ARC, our ARC training, all important things which I'd be very interested to move on. But this is about the school and my own personal belief that we build in strong infrastructures, we collaborate well, but we are mindful all the time that some of these things are little moving targets, and we really do have to ensure that we're able to respond to community needs and internal needs and listen to our students as a very, very important part of what we do. And we're moving down that process. Thank you. Toby.
Thanks, Steve.
Yeah, thank you, Steve. And thanks for not stealing the thunder about our gets for that work. But, you know, the question of how have we embedded and operationalized the principles of community, you know, I think we've been doing this in a number of ways, and I'm going to walk through it, but I think it's really our focus and laser focus on advancing our relationship-based culture. You know, I think we believe that we get things done always through relationships, and to do that through relationships, I think it's through with mutual respect and foundational with our principles of community. Within nursing, within patient care services, we have adopted values that are of extraordinary love, compassion, courage, and integrity. In this past year, in 2019, we had adopted the value of love based on the journey that we were on around relationship-based culture. And I think that word is so triggering and so activating for so many people. And I think it makes people feel vulnerable and at the same time reflectionary. And I'm grateful for our team for being so bold in adopting that value. Other ways that we've embedded, though, and operationalized, I want to walk through some of those structures, is, you know, daily, we start with gratitude and recognition. And we don't move beyond the day in some key meetings without recognizing the contributions that people make to our organization, to our patients, and most importantly, to one another. You know, I joke that I spend more time with probably Mike Condren than my own spouse, Larry Edgman, right? And there's truth to that. And so if I can't uphold those values and also express gratitude and start that as a foundation, and I think my eye on the prize is not there, right? I also think, you know, we read patient letters and stories and connecting who contributed, how they contributed, even from afar and even up close. And I think that's really valuable and powerful. There's been some other things that we've been doing as part of this journey of advancing our relationship-based culture. We've also put in infrastructure, again, around civility and just culture. So from a leadership standpoint, we've invested a lot into our teams as well. But I think that life is just messy, right? And all of a sudden things are being thrown at you. And so how do you anchor back to ways so that you can be neutralize other factors that are irrelevant, right? And I think that is done through our civility policy, but also our just culture policy, right? Because I think it really helps people to walk through a process to go, was this a system issue? Was it a structure issue? Or was it just reckless behavior, right? Because when you take into account what people are going through in their personal lives and then coming up to work, sometimes things just get messy, right? And so how do we neutralize that and create a more level playing field? And I think we really do that through our just culture policy and our civility policy, equipping our leaders with tools to treat people more equally and equitably, right? The other, though, is this journey that we've been on is really that backstory. You know, I recognize that so many of us are more than the sum of the interactions that we have, right? And I think that's even with one another. And I think that's even with people who are coming through our door. Some of our interactions at times can be charged, they can be delightful, but at the end of the day, we're more than a sum of that interaction, those moments. And I think we've been doing a lot about focusing on people's backstory. And one of the ways that we have done that is through the work of Teresa Pack, Melissa Tehrani, and now Jessica Micheletti with our relationship-based culture. And we have a number of curriculum that we require our leaders to go through. One is See Me as a Person. The other is Reigniting the Spirit of Caring, because we recognize what we do is really hard and heavy work. At any given day, people are coming in anxious, scared, frightened, and our teams, wherever you are across the organization, are taking that energy and need ways in which to manage it, work through it, identify their role, and how are they supporting one another. And we think those two offerings really help support our colleagues with that. I will say that, you know, coming to UC Davis, both as a veteran, as a gay man, also as a white man, right? I think that there's a lot in the principles of community that resonate for me. And when I look around and I see people often have pride badges, and I think we recognize that there's a diverse workforce. But I think the one thing that really elevated to the forefront of my mind and my team's needs was around racism and how do we talk about race? What are we doing around racism? And that's not the conversation I think we've had robustly in the past in a way that really helps people be supported and feel comfortable having these conversations about race and colors and all that good stuff and the differences. And I am just so grateful to the School of Nursing, Steve Kavanaugh, and prior to him, Heather Young, bringing on Jan Marie Garcia. She's got just a treasure trove of work in this space. And I'm just grateful she and I came together so that we can put our leaders through this anti-racism cultural humility training. Because I think where we are all positioned and where we come from, our perceptions of what race is and racism and how do we look at privilege and meaning privilege from all different backgrounds, and you can be of different colors and socioeconomics, but still be very privileged. And so how do you talk about race? How do you look to put in mechanisms and structures to prevent racism, to de-escalate, destructure it, but then also support people's advancement, understand what is that conversation really about equity, right? And why do we want diversity? And I think when you can talk about anti-racism and how we got where we are, I think it really turns on the light bulb for so many people, activates people, strengthens people's leadership. And what I think and what I've heard as people have gone through it, they're able to be better leaders to care for their staff. And I think that's so powerful because so many people want to feel safe. They want to feel that they belong. And I think this work that Jan has partnered with us and that we're embedding and operationalizing has just accelerated that. And I'm just grateful. And then just pivoting a little bit, that is Perry, microaggressions, her work on microaggressions and the models that she's built, along with the models that Jan has built. What an invaluable tool for our leaders and our colleagues to utilize, deploy when they're truthfully maybe stuck on a little landmine or got in a sticky situation. Perhaps it wasn't their intent, but it was still the outcome. So how do we make it safe for people to really still communicate and be respectful and uphold people's dignity? I think it's through the work that we've been doing around advancing our relationship-based culture and most recently adding the curriculum of anti-racism and cultural humility. I am grateful to the School of Nursing for bringing Jan Marie Garcia in that work here and grateful for allowing that partnership. So I'll stop.
No, that's beautiful. And really, I'd like to lift up, Toby, is the relationship based culture, right? It has us self-reflect as individuals for us to first and foremost check ourselves before we wreck ourselves. As you were saying, we're in a stressful environment, the pandemic, crazy amounts of toxic stress for each individual, and the harm that continued to happen with all of the deaths. So the healing component that's needed, we really need the kindness that Stephen was lifting up, in addition to Michael, in addition to everything that we know to be true coming from the heart center, which is love. And if we can have that, then we can flourish as individuals and organizations. So the relationship-based culture, and you also had that training for quite a few years, actually, for your nurse leaders and nurses, but you recently, in the last few years, opened it up across the campus to open it up to everyone, correct? Right.
Yes, that's right. There's such a demand, and people, what I love is that so many people were going through it, people were requesting, felt left out, not inclusive. And so we recognize the value of bringing other disciplines, other professions to the table to talk about how we see one another more as a person, and how do we support people in caring as well. Yeah,
it's so important.
A quote recently, and I think all this work, I was listening to Oprah talk recently, and she was talking about love and compassion. And she opened with, you are responsible for the energy you bring into the room. And I think all of this work, Principles of Community, helps you reflect on what's the type of energy that I want to bring in the room. And I think that's how we embed, that's how we operationalize, even on the individual level, principles of community.
Mm-hmm. And that energy, if we focus on relationship-based care across the whole health system, then we're vibrating love and compassion and kindness for all that we serve. So thank you for that, Toby. I also wanted to lift up, you did bring up Dr. Jan Marie Garcia's name. She is faculty with the School of Nursing here. She teaches quite a few classes for our school students in the School of Nursing and the School of Medicine. And just wanting to check in with Stephen and Allison, you too also had participated in the Sacramento Health and History Tour, right?
That's right. That's right. We went with Jan on the Sacramento Health and History Tour, and it was several hours, and we actually learned a lot about the roots and the roots of systemic racism in Sacramento, and the redlining, and how neighborhoods were created and divided by the highways as they were built. As someone who grew up in the Midwest, but spent 15 years in the South and is new to Sacramento, it was really very instructive to understand and see how processes and systems created economic disparity and racism, and kind of it's a virtual cycle that needs to be broken. And Jan was just incredible at instructing us and showing us. We actually saw a gate. She showed us a gate that was left from where there were neighborhoods divided, and one gate was still there, and it actually still had a lock on it. And it was just really a reminder of how much more we have to go. So I was so pleased that she developed that program for us, and I would highly recommend anyone to go on that.
Absolutely. And building upon that too, of course, we also had a chance to look at a school and some of the great challenges that our communities really do face on an everyday basis. And sometimes we forget about the breadth and depth of the challenges that we face. And the beauty about this was not just for me coming to Sacramento really for the first time to understand some of the things that are going on, but really the depth of the challenges that we face, the historical structural challenges that are still we face today. And even now, in fact, I still walk around some of the bus areas. So for example, the last remaining Japanese American space from what was a large community, and even of course the history of the town through such things as graveyards. I'm not wishing to be morbid, but there's a history there about Sacramento that still resonates today about how populations were divided, even in both life and death. But out of all that, I still came quite optimistic. I see a lot of great things happening in this city. And obviously UC Davis is driving so many community initiatives. And so I have to remain positive on all these things, but it was a really good anchor visit to just what Sacramento has been and really can be.
Love the positivity. Being able to look at that history, extremely important so we can correct history, right? And with Mike's work with the vaccination distribution and the lens of equity with all the partners that you're working with, Mike, I see that consistent strand of positivity and the growth, right? We know where we've been. We don't want oppression. We don't want racism, but we're moving forward as an institution with all of your leadership. Also wanting to lift up for all of you that we've also partnered, Dr. Tan and myself have partnered with the California Endowment, and we're going to have a webcast on March 25th on vaccines for our people of color, and really looking at all this history, any hesitancy that's there or mistrust, and really what do we do as communities of health to really advance that. And who's going to be the panelist? Dr. David Cook. We're also going to have Dr. Perry Ackerman Barger, and we're going to have one of our Black resident organization leaders, Dr. Zola is what we call her, and she'll be on the panel. In addition to Art Hernandez will also be taking part in that, and he's from Toby's team. So this is just one example of how we're collaborating our efforts, once again, to eradicate inequities and really innovate with all of our human capital here at the health system. So with that, our final question, just wanting to start off with all this great work, what the principles of community mean to us, but then wanting to also look at what is our vision to advance principles of community. Once again, what is our individual vision to advance the principles of community? So Allison, I'll turn it to you.
So I think we all need to be very purposeful about putting things in place and measuring those. And so as the students come back, we're working towards having all of our educators in SEED training, which is 7 hours of training on diversity. We're being very purposeful about expanding the number of faculty we have from underrepresented groups. Our medical students come, 50% of them return to primary care, and 60% of our students take care of people from disadvantaged backgrounds. And so we're really trying to be very purposeful about making sure that we're making a difference, and that we're really, I think, putting our words and actions together. I am so proud of everything that's been done during COVID, and Mike's work, Toby's work, Steve's work, that really has brought opportunity to the community and brought education and research directly into the hospital and into the community. I too went to one of those vaccine clinics last Saturday, and it was just incredible to see how when you put a vaccine clinic in the middle of a community, the outpouring of interest. It really warmed my heart to see how much impact we're really making in the community. So I have all wonderful thoughts about how the core foundation of relationships and just being inclusive and respectful really is changing the way we are going to be taking care of patients and teaching and being role models for the future. I am so positive on the future. I will reflect and remind everybody that today is February 26th, 2021. And it was actually a year ago to the day that we discovered that we had the first community acquired case that went national, and all the trucks were outside my office and I want to just take a moment and reflect how much our community bonded together during an unprecedented time of stress and unknown and fear, and really worked together every single day, sun up to sundown, 24/7, students, residents, faculty, staff, community, to make sure that people stayed healthy, that we were able to bring new treatments to them. And that to me is just a representative of the core values of UC Davis, doing it all for the patients in a very inclusive and respectful way. So I just find it so heartwarming that a year from now, we've come so very far in terms of our ability to fight this terrible pandemic.
Thank you, Allison. Beautiful. Mike?
Yeah, thank you, Allison, and for pointing that out too, because in some ways I just can't believe it's already been a year, and in others it feels like it's been 10. It feels, shaping our vision for the future, I think starts with listening to our employees. Toby, I really want to compliment you. You've been such a leader in improving our organization, and the work that you and Brad together have done over the last year, 18 months has really been important despite the pandemic. And I'm pleased to communicate that Brad, ECTA, and I are partnering on a diversity, equity, and inclusion initiative under ECTA's leadership that really starts with a listening tour. Mary Stutz is our wonderful partner guiding us in this effort. She's following on the impactful work she's done at Stanford. And, her listening tour is, I think, now double in length of her initial plans because there's so much to hear. And one conversation leads to another. And she's being super thoughtful, not saying, okay, this phase is done, I'm going to the next. She's listening and accumulating an incredible amount of wisdom from employees at all levels of the organization on how we can do better, how we can advance the principles of community, how we can address and recognize our unconscious biases, how we can improve our practices to make a more equitable and inclusive workplace that we're all proud of. So I'm thankful to her partnership and really look forward to continuing to listen to our employees, be humble, to Toby's point again, accept this feedback and become better from it.
Thanks, Mike. Stephen, what is your vision to advance the principles of community?
Lots of ideas. And firstly, of course, our other panelists are being hugely modest in the success that they have done. And I want to thank, start with Toby, if I may. For some of you who may not know that during the time of the pandemic, many schools throughout the country, schools of nursing, were not able to continue their education. The Betty R. M. Moore School Day, we did not miss a day of clinical practice for our MEPN students because Toby and his team embraced all the things we talked about and enabled our students to continue their practice and really live through and learn an unprecedented thing. So Toby, that's just living embodiment of what's important. And for Mike, the work we've done on the Healthy Aging Clinic has embodied the ability of cooperation and spirit and coming together to really believe that we are stronger, bringing people from diverse professional backgrounds together. And Allison, who's very modest, of course, who probably has had for the last year, you've probably kept them, the scientific briefing meeting, I call it, that early morning meeting, which has been the absolute clarion call of sensibility without all the press and all the things that are going on, but never forgetting that we're working with patients, and these are really human people that we are talking about. So all those have come together, and putting that together, the school, and what I've been trying to do here is to really build long-lasting infrastructure. So with Piri's help, we're working on a diversity strategic plan, not having something lost in a complex document that's about budget. We talk about strategic plan that's about behaviors, expectations, and that's very, very important to us, which also moves across into our student environment, where we're doing things from reviewing content of textbooks to make sure these really are the materials that we want to put in front of our students, as well as a real commitment that once a student's admitted to our school, we are committed to doing our absolute utmost for them to be successful, and recognizing the challenges that some students come from, the obvious, no internet and family life and all those things, but that commitment to the future of our workforce. And my goodness, as all of us know, that the need for professions, whatever our training in the future, is right now insatiable. And so together we have to think about the workforce we're doing. We have to think about our anchors. I've heard that used before. I absolutely agree with that. And my hope is one of positiveness, that we will increasingly bring in a more diverse student body. We've done extremely well, by the way, of course, but one can never be complacent here. And we're working even now recruiting new faculty who bring a breadth and depth of both national and international experience to healthcare. And that's really a hallmark of really great institutions. And we can all be proud that UC Davis Health and the university is a great institution. Thank you.
Thank you, Stephen. Toby.
Well, thank you all for those kind of words. And also to just really quickly on how we're going to enhance diversity, equity, inclusion, and principles of community here. Just want to also give a shout out to the panel, just in case we run out of time, and then all the committee members who put on Principles of Community Week. I know today is the last day of it. It's a heavy lift. It's a lot of work. I just want to recognize everybody who's come together to make this happen and unified across the entire UC Davis campus, both the main campus and here. So kudos, kudos, kudos. A few things that we're going to do to continue to enhance it. We're going to listen and we're going to give space to where people need space and be open to where perhaps we didn't know there was a need, but acknowledge that there is a need and look at how do we support those people who are bringing a need to feel more inclusive or a feeling of more belonging to where perhaps we didn't know it was there. We'll do that through different forums. Building on the work that ECTA is doing with Mary around DEI, your office, Henry Tahn, our own nursing DEI council, looking at how are we delivering care in a cultural humility way. We're going to listen also through our healing circles that Marcus Christensen is doing along with your office and helping people share their experiences. Gosh, I was going to mention one other thing. Also, we are looking at our workforce. We're putting out on paper, what do we look like from a nursing workforce? What's coming out of our schools to create the nursing workforce? And how do we compare to what's being licensed in the state of California? We're not just talking about that, but we're putting that data and we're putting it out there for all of our leaders to see. We're talking to nurse recruitment and being very, as Allison would say, very purposeful, very intentional, and not putting blame or judgment on people when we look at where we are at. I think it's just a reflection or a mirror and making people feel safe, and then having conversations about how do we bring other voices, other people to the table to really make us stronger, to help us care for patients better. And I think we'll do that with that strategy of diversifying the nursing workforce and the overall workforce, and also recognizing it's a marathon, not a sprint. And sometimes we have to grow these pipelines. So, how do we listen to staff who are really activated and want to grow these different pipelines of our workforce? And I think we can do that. And we're committed to doing that work.
Thank you all. The intentionality, I hope everyone that's on this call here understands the intentionality and energy that our leaders are putting forth. That trickles down to all the work that we get to do as employees. I hope this made you think about your own actions with Principles of Community, but also walk away with pride of what our leaders are initiating. Thank you so much. This ends our session today. We'll be sending a survey, so please go ahead and answer the survey. And leaders, would you be open to coming back another time?
Of course.
Maybe next year?
Indeed.
That would be lovely. I hope everyone has a wonderful afternoon. Thank you all for attending. Goodbye.
Thank you.